everyone. I'm Megan McGurman.
And I'm Jason Tokarski. Welcome to another episode of For the Love of Health, brought to you by Christiana Care.
The donation of an organ or tissue is perhaps the greatest gift of life and health a person can give. More than 100,000 men, women, and children are on the national transplant waiting list right now.
Christiana Care has earned the highest level of national recognition from the U.S. Health Resources and Services Administration for its outstanding support of organ and tissue donation.
Christiana Care's kidney transplant program is the only adult transplant center in Delaware. Here today to talk to us about kidney donations are Kealey Johnson, lead transplant social worker, and kidney transplant patient Bill Wilson. Kealey and Bill, thank you both so much for your time today.
Thank you for having me.
I'm thrilled to be here.
Kealey, let's start with you. Can you give us some context of why we're having this conversation today and why kidney transplant is so important to talk about?
Kidney transplant transforms lives. They don't have to do dialysis anymore, which is a huge change for someone's life. A person could have kidney failure and they're not on dialysis, and it saves them from doing dialysis. It gives a person a new lease on life. It prolongs their life, and it's something that people aren't aware of. Like, a person could donate a kidney and they can live with one kidney for the rest of their lives, and people are just not even aware of it. Some people are actually born with just one kidney and they don't even know. So kidney transplant, it transforms people's lives. It extends a person's life, and it is something that is vital to the health and well-being of our community here in Delaware, especially since we're the only transplant center in the state of Delaware.
Bill, you are a perfect example of everything Kealey just said. Your transplant was this past April.
Yes.
Talk to us about how you ended up needing that transplant.
I never thought I would have to be the one to take treatment of dialysis.
Right.
Like, because it doesn't run in my family either side, mom's or dad's side. So it just happened to hit me out of everybody. Like, I wasn't suspecting that to be on treatment or dialysis for 4 years or any time, for 4 days.
Right.
That's too long.
Right.
I thank God because I finally got that phone call. When they reached out to me, I was overexcited. Like, I literally started dancing in my home. Like, I was dancing and jumping for joy. They're like, you got to get here right now. How fast can you get here? So I'm like, I'm not far. I'm 15 minutes away. So I got my brother who literally just got off of work. I said, brother, we got to go right now. Like, what's wrong? Dude, they called me for the kidney. And so we were overexcited. He rushed me down there. And so that's how all this started and came about.
Bill, you are very clearly excited. You were so excited. You were for anyone watching the video version, you were moving the table. That's how excited you still are about this opportunity to have your new kidney.
Absolutely.
Let's dive a little bit into the program itself.
What makes Christiana's program so special?
We do living donor transplants as well as deceased donor transplants, and we do upwards of 50 transplants a year, and it's going to continue to grow. Between, like, say, Johns Hopkins and Penn in Philadelphia, so Hopkins in Baltimore and Penn in Philadelphia, it's us here in the state of Delaware. So we have patients that come from New Jersey, of course, Delaware, and not just like this region. We have people come all the way 2 hours, like they travel from the beach to us. We have patients from the tri-state area. We're located on Newark's campus, the main campus. We're in Medical Arts Pavilion 2, and you pull up in front of Medical Arts Pavilion, get out of your car, and walk into the building.
Yes, you do.
So that is something that I think is unique about our center, and it's a benefit to people because you can't just assume that, if a person is paying $16 for parking, that's something that's cheap and somebody can do it, over and over again, because when you're transplanted, and Bill is aware of this, you have to follow up with us a lot. Just like Bill's excited, we get excited with him because our team is cohesive. So we are a very well-oiled machine, and we're a very connected team in that we respect each other's expertise. Each of us are very experienced. I'm an experienced social worker. We have experienced nephrologists. We have experienced nurses. We have experienced pharmacists. So for one, we're at the transplant center because we love being there. Yeah. We could work someplace else, but we love being there. And we're passionate. I am absolutely passionate about what I do. I talk about it all the time. I'm in the grocery store. I'm everywhere. I talk about our transplant center because, for one, people aren't very aware of ours in the state of Delaware, even though it's been in existence for 16, 17 years. But they're not very well aware of our transplant center, and people aren't aware of how life-changing it is. I educate people on donations in and of itself that some people think they're going to die if they donate. It's like, no, you could give somebody one of your 2 kidneys and you could live for the rest of your life fine with one. So that is something that I'm very passionate about. I'm very happy about. And like I said, our patients come through the door and they feel a sense of, it's almost like unity or family. I know that sounds like cliche and people may not think it's true, but it does feel like that when you walk through the door, right?
It's true.
We get to know our patients because our patients they come in for an evaluation. We call it list of follow-up appointments. So we see our patients 2-3 times a year, and then once they're transplanted, we see them twice a week for a month, and then once a week for another month. So we see them a lot, but we get to know the patient, their family, his brother. I know exactly who it is. We know if you have a cat or a dog, and the reason we know that is because everybody is affected by kidney failure. It's not just the patient; it's their family. Their family wants them to do well. It's their neighbor. People. We say people have a village. Sometimes it's a family member, sometimes it's a friend, sometimes it's a neighbor. We have a paper that literally say, who are your people? We want to know who are the people that's going to support you.
The vibe is there. Like you can feel a good vibe. Like starting with the receptionist there, they greet you with a heavenly smile. And I'll smile back because that's important. That is very important to feel like you're loved. Especially after being transplanted. You want to feel that sensation, that vibe there, and they have it. The whole team has it. Like, I want to go there. I stop all things just to go to my kidney appointments. I want to go because they give me that respect. I feel that respect there, and that's why I keep my appointments with them. I got any things to do? Oh, no, I'm going to see kidney
It's wonderful.
That's important to me.
This wonderful experience out of something that seems so drastic and life-changing, clearly it is.
Yeah.
How does someone end up in your office? What does somebody do if they need to have that transplant or they're considering the donation as well?
One way a person comes to us, they get referrals. So we have a referral system. There are a lot of people who are on dialysis, so the dialysis centers speak to their patients, which are dialysis patients, about transplant. So we get referrals from our dialysis centers. We also get referrals from nephrologists. There are patients who are not on dialysis yet, and their nephrologist suggests for them to come in to get an evaluation. And then there are some people who are just aware of it. They look it up on the internet or Google it, and they do a self-referral. So we get referrals through our system. Each person that gets referred to us, we start the process. They medically have to, be cleared to come in. Right. Socially, they have to be clear. Like they have to make sure they have support and transportation and, things that's going to support them once they're transplanted. They have to have their insurance in place. So then we have our finance team that gets involved. So it's a process. But once a person gets referred, we start the process. And if they have the right insurance, then we just keep moving forward. There are some people that can't because they don't have it's not the right time. They don't have the right insurance, but we work with people. We give them suggestions on what insurance does work for, that we at Christiana are on par with, or we say, okay, now that you know that you live by yourself, you need somebody that's going to support them. You can go out and talk to your family, go out and talk to your friends and get that in place and come back to us, or you can get evaluated and still look for it. But patients come to us generally 3 ways: by their nephrologist, which is a kidney doctor, from their dialysis unit, or self-referrals.
And I think that self-referral is kind of the important one for people to be aware of there, because you're probably thinking, I've got to be going through this whole process with my doctor and everything, right. But you accept people who just call you out of the blue.
Absolutely. It's a system that they go through. It's through the computer. But yeah, a person could do a self-referral. People call us. They call the transplant office to get information. And then, like you were talking about donors, there are people that want to donate. People want to donate for various reasons. It could be a friend or a family member who've had kidney trouble. It could be they don't know anybody with kidney trouble. They just realize that they can live with one kidney and they would like to donate one. So donors come to us. Sometimes donors come to us and they don't have a person in mind. They're saying, I want to donate my kidney to somebody in the state of Delaware. Or I just want to donate my kidney to somebody that could use it. And of course, we do their workup immediately. We want to save somebody's life because we consider our donors heroes. So we're like, yeah, we want to do it. If you're if you're healthy enough to donate, we want to do more and more living donor surgeries. We're doing like 10 to 12 of them a year, but we want to continue to do more and more. And that's getting the word out. Things like we're doing now and talking about it. in ensuring that people won't be harmed by giving a kidney? That's a question that a lot of people say. When you meet somebody and you're like, oh my gosh, you have 4 children. Did you ask any of your children to be a donor? And they're like, oh no, I don't want to harm them. And I'm always saying, but they won't be harmed. They could help you. And if in the long run they need it, they're going to be transplanted too. So I think educating is a big thing too.
And Bill, your donor was a deceased donor, correct?
That is correct.
So what is your message to those who are maybe thinking, I'm not necessarily on board with the living donor, but I could register for the deceased donor option?
You sure can. It could be the family. It could be the family that says, listen, this is what we have decided to do to honor our loved one. Because I always say that to people, it's not uncommon for patients to have, it's almost survivor's guilt. It's like, well, I'm benefiting from somebody's death. Because a lot of times they are deceased donations, right? Yeah. And I always say, it is like me, Kealey, I decided at 18 that I was going to be a donor. So once I go on to glory and my organs hopefully can be used, is something that I personally decided. Nobody forced, because you can't force a person or pay a person or buy a person a car to donate. Or it could be a family. The family member gets together, the gift of life talks to them, and they decide that that's what they want to do. So either way, it is something that is done in love, I think. I think it's done in love, and I think it's done to try and maybe do something positive about a person's legacy. So that's how I look at it.
Tell us how things are going in the 8 months since you're...
Oh, my God. This 8 months...
Has it been 8 months? Wow.
This 8 months has been terrific. It has been absolutely amazing. I am doing things I thought I would never be able to do again. I'm continuing to go forth every day. I'm moving along, and I feel energetic. Like my energy came back.
Yeah.
I feel like Bill again.
Oh, wow,
I feel like
great.
Bill.
That's what we say, too, to patients. We say, well, for one, imagine, I don't think people get the grasp of it unless they either have worked in a dialysis unit or have been on dialysis or have a family member. I mean, you're literally connected to a chair for 4 hours, 3 days a week. So, okay, imagine sitting here and not being able to move. You can't get up and go to the restroom. You can't go for a break. You have to sit in this chair for 4 hours, 3 times a week. So that's a lot. That's a lot of your life. And it's not always pleasant. There are times when it could be painful. You can get cramping.
Yes.
Am I right?
I've been there.
Or you're just not feeling good, but yet you have to be here. So, I'm going to get up and go to the beach. Well, it's not that simple, right?
Exactly.
You can't just get up and do that. You have to connect with the dialysis unit and try and get a unit somewhere else. So that's difficult for people. And even people who do peritoneal dialysis or hemo at home, but even that's taking supplies and moving things. It is a lot involved in it. And again, it's life-sustaining. And I'm grateful that we have dialysis units, because in the past, people wouldn't survive it. But just imagine, even the best job you have in the world, like if I like eating cookies. If I had to sit there and eat cookies for 4 hours a day, it would be difficult, right? So I always say it's like Christmas when I see our patients. When you go and see our patient, we don't bother them the day of surgery, but the next day, it's like a child at Christmas morning. Like we get to experience that over and over, and it just reconfirms why I'm here and why I love what I do, because you can see they're grateful, they're happy, and beyond those words, I know that they're going to feel better.
Yes.
So that makes me feel great. So it is literally giving them back their life. They can go see their grandchild. They can go visit their cousin. They don't have to check with somebody to get a dialysis unit. So, I think it's wonderful.
I know it's wonderful. It's definitely a lot. And again, I was on for 4 years, and I never missed a treatment in 4 years.
That's wonderful.
So I, again, highly suggest to people that's on dialysis to keep going. Like, you can make it. Yeah. I know you can. I did it. You can do it. That's motivation. Just keep living. You got to live one way or another, so keep going and keep striving. It'll happen. It will happen.
That's awesome.
And before we go, Kealey, what is your message to those who are listening to this thinking, I think I can help somebody?
Everybody out there, please give us a call. Like, call a transplant center. Of course, I think our transplant center is the best in the world, but call a
I know so.
Call the transplant center. You can just get information. You may be a living donor, you may not, but just for information, there's so much information we can share with you. And there's so much disinformation because people are just not aware. People think, oh, I have to be this or I have to be that, or just let us know. Like, we can let you know up front if, we think certain things that if you may have yourself will rule you out, but don't diagnose yourself. Call us. We'll share the information because we have the exact information. We have the correct information. And we want to hear from you because if you can donate or you can't donate, at least we can share information with you that you can share with somebody else. So call our transplant center. We're always there. We want to help and we want to answer your questions.
They are the best. So call them. Yes.
I agree.
Kealey and Bill, thank you both so much for your time today.
Thanks. Thanks for having us.
We'll have more information on Christiana Care's kidney transplant program and organ donation in the show notes for this episode.
And don't forget to subscribe to For the Love of Health on Apple Podcasts or Spotify.
We'll be back in 2 weeks with another great conversation.
Until then, thanks again for joining us.
For the love of health.